Hello, for this week we are talking about harm reduction. And my initial understanding of harm reduction is removing or applying means in order to reduce harm in an individual. And that can be either restricting certain environments, connections, and medias in order to reduce harm, or apply connections, environments, and medias to support the client. However, when looking through the media and the information shared from this module, I have come to terms with the fact that you are really aiming to just reduce small means of harm rather than trying to get to a long-term or end goal. In the narrated PowerPoint at 221, it says that every step towards safety matters, and then it talks about this truck that was promoting clean needles, and it really focuses on, rather than trying to criminalize and punish people for using, we are now trying to just reduce harm. So we know that it is a reality that people will continue to use substances, and rather than focusing on punishing them or treating them as criminals, we should aim to reduce harm and not amplify it. This was highlighted in the PowerPoint at 242. Programs, and in the harm reduction therapy for addiction video at 39 seconds, it mentions that programs would work with individuals to change or educate them and focus on changing policies, environments, and just their overall thinking about their substance use disorder. And this way, this reduces harmful consequences of substance use. So it kind of pulls away from, again, the criminalization and punishment and applies more harm reduction. Focusing on the prompt, which is harm reduction a viable approach for anyone who meets diagnostic criteria for substance use disorder? I believe yes. Based on the PowerPoint at 304, the narrated PowerPoint, we know that shifting policies from punishment to harm reduction saves lives. It was done in other countries where instead of punishing those who are using substances, we are now trying to promote clean needle use, other sorts of harm reduction resources such as that, in order to promote saving lives and focusing on the individual themselves rather than the substance use disorder that they possess. As counselors, we obviously want to reach the end goal of attaining abstinence for our clients. However, that isn't necessarily a realistic goal, and it sometimes isn't even something that the client wants. A client can go to treatment and not want to be sober. They don't see themselves being abstinent or finding themselves being abstinent. And that is something that we have to adjust to as counselors. And instead, we should assess the harmful consequences that are coming with their substance use and try to figure out what the first steps can be, and working towards small obtainable goals in order for our clients to find their own recovery. This was mentioned at 347 of the harm reduction therapy for addiction video. Overall, the general understanding that I possess now about harm reduction is that we do want to still focus on long-term goals. When we have clients come to us, we want to look for goals that they want to see themselves doing in the future. We want to see kind of what the finish line looks like for a client. However, we also want to come to terms and have our client come to terms that it's going to be a journey. There is going to be relapses. There are going to be moments that you feel possibly weak. But this is also stigma that comes from the outside sources of saying that relapsing and feeling weak and going back to your substance, you should just say no, abstinence. All these things are pushed onto a substance use disordered client, and we really just want to focus on trying to engage the client on small obtainable goals in order to reach their long-term goal, so that we can reduce harmful actions and consequences.